Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have our presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically anytime using the Q&A pod located to the left of your webinar platform. You may also download a copy of today's presentation using the Resources pod located directly below the Q&A pod. It is now my pleasure to introduce today's first presenter, AHA moderator, Laura Castellanos.
Thank you. Hello and good day. My name is Laura Castellanos, Associate Director of the American Hospital Association and lead the Hospitals Against Violence initiative. For this webinar, we're proud to partner with Heal Trafficking and Jones Day Law Firm. We're working together to bring a series of educational opportunities like this one, covering a range of topics to support your efforts in combating human trafficking. We're delighted to bring today's webinar, Nurses Leading Efforts to End Human Trafficking. This webinar will explore the significance of grassroots efforts in combating trafficking through the journey of a nurse leader. This session will discuss how communities, health systems, public agencies, and states are also working together to coordinate efforts and share learnings. Through the efforts of the AHA, Catholic Health Initiatives, and the Massachusetts General Hospital's Freedom Clinic, last year, the CDC released the first ICD-10 diagnostic codes for classifying sex and/or labor trafficking. We're committed to raising awareness of the new codes and how healthcare providers respond in a trauma-informed and person-centered way. Please visit our website to access webinars, fact sheets, and other key resources. We know that together we can end human trafficking, so please contact us with any questions and feedback. So it is my absolute pleasure to introduce today's speaker. Ingrid Johnson is the Manager of Patient Access at Overlook Medical Center, a member of Atlantic Health System. As such, she represents Overlook on the New Jersey Coalition Against Human Trafficking. Ingrid serves as an advocate for victims of human trafficking as well as other vulnerable populations within her community. She has received many accolades for her work in the community and is passionate about advocating for others. Most recently, she was honored by the Jefferson Awards and received the Jacqueline Kennedy Onassis Award for Outstanding Public Service benefiting local communities. She's the mother of a survivor of human trafficking, and we're delighted to host her and have her share her story. Ingrid?
Good afternoon, everyone. It's an honor to be here. I'd like to thank Lara and AHA and the Hospitals Against Violence for having me be with you today. So next we'll talk about our objectives for this section. So we're going to define human trafficking for those who are still unclear as to its definition. We're going to discuss efforts nationally and locally in New Jersey to eradicate human trafficking. And then we're going to discuss nursing's efforts to identify the red flags and the work that we're doing at Overlook Medical Center and Atlantic Health System. And then I encourage all to talk with their organizational leadership to get them involved in the fight against human trafficking. So the AMP model, AMP, is a great way of more clearly defining what human trafficking is. The action, as you can see, is to induce, recruit, harbor, or transport by means of force, fraud, or coercion for the purposes of commercial sex or labor trafficking. And as you can see on the bottom, minors induced in the commercial sex or human trafficking victims regardless of having to prove the force, fraud, or coercion component. And so this is a global problem. This is a public health issue that demands our attention. As you can see by this slide, 46% of the cases reported in terms of human trafficking involve some form of prostitution or sex trafficking, and 27% are domestic servitude or labor. So there's a lot that goes on with trafficking. My experiences with the sex trafficking. I love this slide because it says to save his life and find your own, be a nurse. I truly feel that in saving my daughter's life, I found myself, and I found a love that I'd never had before, although I love my profession, but I saw the power and value of being a nurse like none other. And so I am proud to be a nurse and a healthcare provider. So I'm going to tell you a little bit about my story so you'll understand what brings me here. In 2004, my daughter was 13, one of 3 of my children. She was an honor roll student. She was at the top of her game, receiving a fantastic education at a private middle school in our community. She was hanging out with friends, trying to find herself with peers, as a lot of young people do. But one day she went missing, and then she went missing for 11 months. I did not know where she was. I worked with local law enforcement to try to find her. Her picture was in the police cruiser. I then worked with the state police for missing and exploited children. My daughter's picture was posted across America in Walmart, on milk cartons, on Channel 7, and other news media sites as I tried to find my daughter. I heard nothing until about midway into her being missing. And then I got one call. I was a night nurse at a trauma center, and I missed the call, giving a report in the morning to the oncoming nurse. I got into the hallway of the hospital to play the voicemail message that was left for me. And it was my daughter saying, "Mommy, I miss you. Mommy, I love you." And that was it. There was no ability I tried to dial back. I couldn't dial back. I went to the local police in the morning right away, and I found out there was still nothing I could do immediately because I learned we did not own our phone records when we chose to have these bundled telephone packages with your cable bill. And so I went home, continued to manage my family, and I continued to go to work. I never missed a day of work. I never told anybody about the situation. I was thoroughly confused. I was embarrassed. I was hurt. I had a surge of emotions. Sometimes I felt that my daughter was just outright dead. I was beside myself. And then other days I would feel her spirit was alive. And so I continued to do what a mom does and what a wife does in raising my children and supporting my family until working with the state police, they eventually were able to get to a subpoena the detailed phone records. I worked with the state police, and I personally made those calls. There was no one else who seemed trained and skillful and understood the situation to be able to do so. And let me also let you know that I didn't know anything about human trafficking at this point. And so it was not even part of the discussion. I was simply a mom looking for my missing child. And so upon getting those phone records, that's when they found out that instead of still being in New Jersey, my daughter had crossed state lines, and the call was made using a phone tower in New York. And so from that point on, I began posting flyers in the New York region and in proximity to the police precinct. And so I introduced myself to the police and told them that I would be out on the streets and that I felt comfortable to do so. And you have to know that nursing saved my family. And the only reason I believe that I felt comfortable being out there like that was because I had worked in so many various capacities as a nurse, including in behavioral health. And so, a long story made short, eventually I began talking to people who had come in contact with my daughter. They were Johns, they were pimps, etc. And then there was people who were fearful to go back to prison. And so they began to try to arrange for me to meet with my daughter. But you should know that my daughter's first response was, "I don't want to see you, and I don't want to come home." The nurse in me realized that something didn't sound right. Either it was some type of alcohol or something, and I did not trust that my daughter was speaking her truth. And so something in me just rose up and said, "Tell me to my face. If you would tell me to my face, then I will go away if you truly don't want to come home with me." After some efforts to get me to come to wherever they were in New York City, my daughter knowing I really didn't know anything about New York past Manhattan, they made a plan for her to come to me. And so with police behind me in undercover police cars, I waited for hours and gave up many times as I waited for my daughter to come to that train station. It grew nightfall, and I still was like, I'm just sulking. And I finally got back in my vehicle. The police told me they would not leave me, that they were here with me for as long as necessary. And then eventually my daughter did appear. And so in speed dating you a little bit, my daughter appeared. They said, well, this is not over. We need to take all this back to the police precinct. And then I got to the police precinct. They said, well, she has to want to come home with you. And so thank goodness my daughter did want to come home with me. And but I was still alone, came back from New York to New Jersey in the car without any law enforcement because my local police said they would not come over to New York to bring us back. And the state trooper and the division from the missing and exploited children wanted to come. But if you know anything about New Jersey, Atlantic County and New York are miles away. And I just thought that I was still the trained personnel who could handle this with the help of a friend who was with me, and that we would simply cross the bridge and get back home to safety. The next morning, we went to court, reported the whole incident, and long story made short, I took my daughter home myself. Thank God I was gainfully employed as a nurse, had insurance, could get her counseling and all the things that she needed to get started with her life again and back in school. My daughter ended up back in school that February, the same year. She graduated from the 8th grade, went to a magnet high school in the area, graduated in 4 years, and then my daughter went on to college and received her degree within a 4-year period. And so we're the lucky ones, and that's what brings me here to you today. So moving forward, I just want to present to you about our healthcare community so that you can see those who are involved in a discussion about human trafficking. And in New Jersey, in 2018, we were mandated, hospitals and healthcare organizations, to have human trafficking training. But that was a one-time deal, and there's a lot of more efforts in place to expound upon that education. But I just thought that this would be interesting for you to see that some states require nurses to do human trafficking training to renew their licenses, but that's not across the board. So there's policy and position statements. I ask that on your own you look to find out if your professional organizations have a policy and position statement about human trafficking and your role. The role of the nurse across the board is about education and training, screening and identifying, but how can you screen and identify if you're not aware of the definition of human trafficking and you're not aware of the red flags or who to call. Also, we should be involved on local and national levels about policy development around human trafficking. I'm a member of the New Jersey Coalition Against Human Trafficking, as mentioned before. The coalition has about 150 or so member organizations. There's many committees, including the Healthcare Committee that I am a member of. The mission is to unite New Jersey communities to abolish human trafficking, and the vision is New Jersey free from human trafficking. All of this is important because Atlantic Health, Overlook Medical Center, wouldn't be involved in this way that I'm going to describe to you in a few minutes in the fight against human trafficking if it wasn't for the leadership of the coalition and the grassroots efforts in our communities. And so there are various hospitals and organizations that make up the Healthcare Committee leadership, and we together work to provide human trafficking one-on-one trainings to different groups, including physicians, medical schools, places of worship, public, private schools. We've also looked at some pre- and post-tests to look at the value of our training and to see if we're making any dent in raising the awareness of those in attendance. We have various events, as you can see. The very last one, Traffic Slam, is coming up tomorrow, and so that's a fundraiser for the organization. But we also talked about ACEs, the adverse childhood experiences, and the connection to increasing vulnerability and early death. We became the voice for the voiceless along with others. And so we've talked to some of the professional organizations within nursing and others outside of nursing, all who are interested in learning more about the fight against human trafficking. So we have a lot of recommendations, but it really embodies what we're doing here today, which is meeting and talking about it and raising awareness and advocating for this voiceless group of trafficking victims. The national efforts are begin with the Trafficking Victims Protection Act. I had an opportunity to meet with Congressman Chris Smith. He had no insight initially about domestic victims within the walls of the United States. And he himself was amazed at how people gathered around to really get in here and really eagerly fight for all victims of human trafficking and bring recognition to what's happening within the walls of the U.S. itself. So there's a National Human Trafficking Resource Center, and they receive tips about trafficking victims and have free information for any caller looking for training materials or other information to fighting against human trafficking. And then there's SOAR, which is from the Administration of Children and Family, and they actually stop, observe, ask, respond to human trafficking. Again, there's the American Hospital Association Hospital Against Violence, which I'm a member of the National Human Trafficking Advisory Council. And so there are many efforts there that have really upped the bar in the fight against human trafficking. And Laura already explained about the ICD-10 codes that were created. We still need physicians to have education and training around that. And in red, you'll see that what we're suggesting that for those who are uncomfortable with what's available, that they at least begin to document suspicion. And then there's New Jersey Commission on Human Trafficking, and they work to do a host of things, including evaluate existing laws. The Department of Health, that's the mandate we had in March of last year to train healthcare employees, clinical and non-clinical. And I think that's a key point. We can't not address the non-clinical folks because they are just as important as the clinical team in the fight against human trafficking. There's all kinds of websites and information as I present here. Please feel free to just Google any of the information from your state, your Department of Health, and I'm sure you'll find similar information about the fight against human trafficking. And again, there's a New Jersey Human Trafficking Task Force as well, and they are looking at the prosecution arm of this as well. I will say as a United States citizen, it's very hard to go and think about talking with federal prosecutors about the issue because I felt like we had no place to run to and no place to hide. But for those who that becomes necessary, I'm glad that that's an option that they can seek help in many forms. This is an example of New Jersey legislation and the support that the coalition tries to give to the cause. And so we celebrate when various laws are passed. And this is one where there's a pilot program for teaching human trafficking awareness in New Jersey schools. January is Human Trafficking Awareness Month, and January 11th is Human Trafficking Awareness Day. So in summary, we all should be getting on board with our organizations to stop violence against humans. And we utilize Kristen Swanson's theory of caring here at Overlook, and I can be caring by showing concern and helping others. So about Atlantic Health Systems and our human trafficking fight. So in 2012, our president and our chief nursing officer requested that I have some representation for our organization on the New Jersey Coalition Against Human Trafficking. Over all these years, the senior leadership throughout Atlantic Health System support my representation of our organization on the state and national level in this fight. So in our emergency services area, we have an acute facility and a satellite. Our ED staff education awareness is happening during annual skills day. We have an upcoming open house recruitment fair. Our physicians have invited me in to speak at their staff meeting. We have our pediatric medical director who's connected with the coalition. We're developing a committee within the ED to allow the voices of the nurses be heard to get their suggestions on how we should move forward as a team. We are looking at future participation in a SOAP event, which is organizing around the safety, stopping prostitution. And so Teresa Flores is a survivor who organizes groups across the country to take bars of soap with the 800 number to call for help, or you can text Be Free so that they can get help. And so the soap is put into hotel rooms so that they can get the number. And then we have EMS education, where we offer CEUs, and we're going to have an annual award dinner for our emergency medical service technicians in the upcoming days. And then our next steps are partnering with case management looking at our shared governance, ED unit-based council, and our continued partnership with nurse educators across our Atlantic Health system. So as you can see, we're doing a lot of work in Overlook where I'm located, but there are others doing work in our sister hospitals, and we're working to connect as well to advance our efforts forward as a united front. This is an example of what I put together for our ED Skills Day. It was the first time that we introduced the topic of human trafficking to nurses in this way. And so I simply made the effort to take what I usually talk about in a presentation and bring it to life as a tabletop exercise. The staff came in shifts. The education is mandatory. And we were doing shifts in 15 to 30-minute increments and telling the story about human trafficking, what it is, and leaving them with information about the red flags, and asking that if they see something, they say something to their supervisor, not to victims or survivors. And then we would then embrace case management, if necessary security, or determine who are the folks that need to be involved to move the conversation forward. So in nursing as a whole, we have nursing grand rounds. We're meeting the magnet objective of teaching and professional development. We recently also had an annual block party during Nurses Week where we celebrate nursing. We have an RN Professional Advancement Clinical Track Program, the acronym PACT. It's designed to promote personal and professional growth and advancement of clinical nurses. I've spoken to the Behavioral Health Department, our case management team, and I've talked with others about assessment and screening tools that just like we do across the nation for domestic violence, we need to add something to that to screen for human trafficking. It's now well known and documented that victims typically do not come forth on their own. And there's a lot of reasons surrounding that, and typically they're scared. And we have to be prepared to help them. I've always said through the years that be careful what you ask for. When you put your banner out to say you're here to help, you have to really be prepared to provide true help and safety, now not just to the survivor of the victim, but to your clinical team as well. This is a picture of one of the nurses who volunteered through the RN PAC project to host a table with me at the RN block party. There I learned that people are scared to talk about human trafficking, and so I had a lot of meaningful conversations with nurses and clinical folks, and it was really helpful as I fine-tuned my approach and my suggestions to others on how to combat human trafficking. So our next steps include a budget-neutral response, and I think that's important because as a leader and manager, we're quick to say I need money. Well, this is not about money. This is about utilizing the tools that already exist in our healthcare organizations and retooling them and being innovative to figure out how we can be inclusive of fighting for this vulnerable population. So ongoing training upon hire and annually, we want to improve upon that. Review of policies and procedures, including domestic violence, as I stated. Talk about the comfort of asking a visitor to leave the room. I think that over the years, I've noticed that healthcare professionals are not as comfortable with doing that. And we need to talk about why, and we need to improve in that area. The comfort of the clinical team engaging in the human trafficking discussion. There's a lack of knowledge, so people are not certain of what to say, how to say it. So I believe we need some scripting around that. And then response to the opioid epidemic and human trafficking. We need patient and staff education on proper disposal of unused medications. And I think that that will also help to reduce the likelihood that when a survivor is trying to move forward with their life, that they don't slip back or try to use drugs or alcohol because it's just simply present to coax, because transforming and moving forward is not easy. There are a lot of legal implications we need to address. My understanding is that physicians can be uncomfortable with documentation. And again, we need physician champions for the ICD-10 codes. to move that lever forward. The clinical management of adults involves trust. There could be return visits, and they will need to connect to your healthcare system. But without trust, you begin to immediately lose the battle to try to provide help to this vulnerable population. We're going to have follow-up discussions with case management, our behavioral health team, security, and our chaplain. The chaplain serves both for not just the patients, but also for the staff. We need to talk about the risk factors for youth. We need to review our community resources. You know, in telling my age a little bit, I can remember that working at different facilities, you knew more about the communities in which you served and who to call in some cases. You didn't know everything, but you knew something. I think moving forward, we do rely more on case management and others to call them. But when you're dealing with the patients, particularly adult patients, we should be prepared to provide them with information because sometimes they don't want to talk to another person. They just confided in one person, and we should be able to give them something. And so we should ensure that our organizations can identify red flags, aka signs of human trafficking. And we should post the National Human Trafficking Response Center hotline number and text information in places agreed upon within our organization. And so let me say that no one should do anything against their organization's policies and procedures. This requires conversation, and it requires innovation, and we just can't easily give up. We need to keep the dialogue going. So for your consideration, our healthcare committee from the coalition recommends that if you're not in the local area of New Jersey, you look for other organizations in your communities that are fighting against human trafficking and join forces, that you participate in trainings like the one today to increase your understanding and competency, that you print out material and have at your fingertips that material that will help you identify the red flags, and that you form small work groups tasked with overseeing the next steps and pushing the conversation forward. So review and look at the possibility of revising your policies and procedures. Develop trusting relationships and make community resources available. And know that for victims over 18, you should be prepared for future follow-up. They may not want to dial a hotline number or get help the very first time you begin to discuss this with them. And for minors, as always, we must follow our organization's policies and procedures for reporting, which will include contacting Child Protective Services. But lastly, we should ensure that all clinical, non-clinical staff and our leadership know what to do. So yes, this involves our leadership. Here in New Jersey, in our legislation, this is the health information that has been promoted. I realize for EMS, it could be a little different because they're dealing with ICE and those who are dealing with customs. But this is the promoted information. And as you note, there's a texting opportunity for Be Free. So if you know someone, this is a national human trafficking hotline, and so you can spread this information along and consider putting this information in your bathrooms or agreed upon places within your organization so that people can freely take the information, hide it until they get to a safer place to make the call. Here at Atlantic Health, we've discussed and we've implemented processes that around the importance of a trusted network of caring. So we look to deliver the right care, the right quality, at the right time, in the right place, at the right cost. And so I encourage you to adopt that at your places of employment. If you see something, we're simply asking that you say something. Behind me is my daughter, and then we are all there on the steps of our state house in Trenton, the capital of New Jersey. It is so important that we not just sit around the table talking about this issue, but that we advocate and get together with others because there is power and strength in our voice. So I will close with a nurse's prayer that I found on the internet, and that it speaks to me, and it speaks to this cause and the fight against human trafficking. And it says, "Give me strength and wisdom when others need my touch. A soothing word to speak to them will calm their soul so much. Give me joy and laughter to lift a weary soul. Pour in me compassion to make the broken whole. Give me gentle healing hands for those left in my care. A blessing to those who need me. This is a nurse's prayer." So I hope that I've been helpful today and providing you with some insight and lessons learned from the journey here at Atlantic Health System, Overlook Medical Center. And thank you so much for having me as your guest today.
Thank you, Ingrid. This is Lauda. I just wanted to remind everyone, we invite you to submit your questions on the Q&A pod. We'll do our best. We have plenty of time to get this conversation going, so look forward to that. Again, Ingrid, thank you so much for sharing your story, your passion, and such great insight as to how we can get started. So let me just begin with asking you the first question. How do we bring nurses to the table for this effort when nurses feel that their plates are already so full?
That's a wonderful question. We are utilizing here at Overlook Medical Center venues for nurses that already exist. So we don't suggest creating anything new. We suggest incorporation. If you're a magnet institution, for example, or you're on the magnet journey, you have shared governance and other opportunities to advance the education of your nurses. And so we suggest looking at those avenues.
Thank you. Let me go on to the next one. You mentioned education for schools, so they would like for you to share what nurses are doing in school systems to bring awareness to this issue.
They're simply inviting coalition members or anyone who speaks on a topic to the school. The school leadership is highly interested, particularly in high schools. I think there's some concern about the younger children, but my advice has been that I think that we could take this dialogue and work to make it fit to be appropriate for even younger generations in high school. But I myself have attended several high school functions as a guest, and we give a slide presentation, and then we have a discussion, and we talk to audiences on their level. And so meeting the needs of high schoolers and talking about keeping themselves safe and the risks associated with certain behaviors and how you could easily fall prey to becoming a victim of human trafficking. And so the feedback from those venues has been powerful, and the students themselves have thanked myself and others for coming.
Thank you. And actually I have a few more questions on this topic. How did parents respond to this education?
I had a shocker in my life where the very school that my daughter was attending, which was a private middle school, I got invited to speak to the parents for a parent night. And so I didn't realize that I was going back to that school. I thought it was another place that they were having a discussion. And so I was kind of overwhelmed at first and wondering, oh my God, what are they going to think? But they were receptive. They welcomed the conversation. And I then encouraged the parents not to panic, because I think that's the first thing we go to. We want to take everything from our children. Oh my God, it can't be out on the bus stop alone. And that's not true. I think we have to have faith in our parenting skills, and we do need to up our game. But we need to keep the conversation going in our homes, at the dinner table, and in any way that we can, and get our children to also participate in opportunities throughout our communities to raise their awareness about human trafficking.
Thank you for that. So moving on, another question, what kind of things can we do on the side of our clinical work or our everyday work to help prevent human trafficking to begin with?
A big one for me is just simply to understand that, number one, this exists, that this human trafficking is not about foreign victims alone coming into the United States. This is not about smuggling anyone. That, we need to understand that there are students who go to school every day who are trafficked when they leave school and their parents are unaware of these circumstances. So I think that in understanding that, perhaps we can just focus on doing a better job with our assessment. My nursing assessment skills saved my daughter's life. I was walking in places I had never been, in projects throughout New York City, in dangerous parts of the city that people thought I was crazy being out there by myself. But when you get into nursing, we are immediately taught that we are empowered to make change happen. And so I believe that we should hone in on those assessment skills and the things that come naturally to us and look at doing a better job.
Thank you. Another question comes from the fact that you're just one person. So we'd like to learn a little bit more about your colleagues that you're teaming with in order to meet the needs of your hospital and the community.
Yes, my chief nursing officer has been instrumental in this part of my journey where my personal life married to my professional life. And I'm extremely blessed to be able to do this work in both aspects. And so it starts there with getting key leadership involved and engaged around the discussion. And then those other areas of nursing, as I stated, the shared governance teams, the emergency department director, and physician leadership, they too embrace the discussion. And so it has left me, and it's with them. I am asked questions, and I'm asked to provide them with the information that will steer them in the right direction so they can make decisions for the organization.
Thank you. I have another question. As a survivor advocate, how can I support medical professionals better in their efforts to combat human trafficking?
I think that everybody, no matter how many times you tell your story, they still don't get it. It's so much to get. But I think that if you're patient with the folks that you're working with and you listen keenly, communication is key, but it starts with listening. There's something even in someone's silence that speaks to me. And so if you listen and work with them and give them small bits, answer the questions directly, get the information that they need, then I think that that's a way to help.
Thank you. And another question is, in regards to the issue of human trafficking, other community violence issues may become relevant. In addition to other community violence issues, behavioral health and substance abuse may also be an issue. Is your work currently expanding into this discussion with your stakeholders?
Yes, that's a great question. I was recently introduced, although we talk about the opioid epidemic nationally and, where people can also dispense of their old medications out of their medicine cabinets, there's a lot of work being done about these biodegradable bags where they're distributed in the communities for free to its residents. And so they're taught that if you can't get to X pharmacy that allows you to turn in your old medications, the one thing we don't want you to do is flush them down the toilet because you damage the water system, the quality of the water. So I think that that has been an eye-opener for me, attending a presentation that talked about both the opioid epidemic as related to human trafficking. And let me also answer that by saying my daughter explained that they push both in front of you when you're a victim, and she had a choice where some are not given a choice. It was either drugs or alcohol. And I think she chose alcohol, although all can be bad when used inappropriately, but she did not come back home hooked on drugs or really hooked on alcohol. And so she was able to move forward in a more at a more easy pace and going back to school, etc. But I think that both are important, and I suggest getting with community stakeholders to talk about the removal of prescription drugs out of our medicine cabinets.
Thank you for that. I have one more question, so I definitely invite our audience to submit their questions using the Q&A box. But talking about potential victims that present to your facility that need culturally competent care, including language services, is there something that you are doing in your facilities to help accommodate this diverse population?
Yes, in my hat of management, I manage front-end staff for patient access registration. Along with the training in the ED, my staff have also participated in that. And so I have expressed through the trainings the significance of culturally competent care. And also through our training as registrars, it's important that we get it right. What is the primary language spoken and read of the patient? And if we don't get that right, it becomes harder to help people and meet their need. So that is how we're addressing it here by including the front-end people in the training as well.
Thank you for that. I have another question talking about how you're teaming up in your facility, but looking beyond. Can you talk about what other organizations you're working with that are helping the victims once they leave your facility?
I first of all want to say that, again, the word potential victims that are within our facility, I can't speak to any specifics of a specific case found in our facility. I would say that we, like other organizations across the country, are fairly new at getting to the point of recognition in terms of the education and training that's required of our staff in order for us to move forward with true identification and any involvement with law enforcement. But in terms of organizations, through the coalition, number one, it brings many organizations together who would have never known about one another. And also through case management, they have a resource guide that they use, and then some of those organizations are already trained and aware about human trafficking. And so what we look to do in the future is have a more in-depth conversation about those tools and access to those community resources. So I can speak to it and say that in the communities, when I go to events, you continue to meet more people who are fighting against human trafficking, and we encourage them to join the coalition and others so that we can advance the conversation.
Thank you for that. It definitely shows us the need to really connect within your community and learn the resources that are available, which then leads to really creating that additional awareness and education. I want to thank you so much, Ingrid, for taking our questions and answers. That will conclude that portion. Again, I want to invite everybody to our Hospitals Against Violence page. I just wanted to mention Ingrid was kind enough to provide her contact information. Again, this presentation is available for download. But just really want to invite you all to join us. We're continuing to do these monthly educational offerings. If there's any suggestions, please feel free to reach out. But again, Ingrid, I don't know if you have any final thoughts, but I can tell you from the comments from our audience, they're very grateful, definitely admiring the efforts you've undertaken and applaud your leadership. Definitely from our Hospitals Against Violence effort, we want to thank you for sharing this and know that you're inspiring many.
Thank you so much. And lastly, I just want to say you should also look at your local, or if you're in the New Jersey region, the New Jersey Pediatric Association, because they do a lot of great work. Look at your trauma centers, and so there's others in the communities that I might not have mentioned that are doing work as well. So please reach out to your community stakeholders.
Thank you. And that will conclude our webinar. Stephanie?
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.